Victoria Atkins, you're saying today that you're going to get pharmacies to take on some new duties to free GPs. You reckon that'll give you GPs an extra 20 million or so appointments. How are pharmacists supposed to do this when, according to the Nuffield Trust, they've had a real terms funding cut of about 16% in the last year?
Well, Trevor, good morning. And this is part of my reforms to the NHS to make it faster, simpler and fairer. And we're doing this with record numbers of doctors, nurses and staff in the NHS. We're rolling out technology across the NHS to help both staff and patients. But I also want to bring care closer to us as patients. And this includes our Pharmacy First programme, which we launched in January and has been really, has had really confident start. I want to expand Pharmacy First because it's good for patients walking in off the street for the 7 most basic conditions. We're going to increase the number of conditions that pharmacists can look after. It's also good for pharmacists because we want to use these highly skilled professionals to the top of their licence. But there's even more to this announcement today.
Well, hang on.
Because we're rebuilding GP surgeries and CDCs.
Just unpack what you've just said.
Right.
It's great for pharmacists. You're giving them more work and less money.
Well, that's not correct because we have funded Pharmacy First to the tune of £645 million. We've seen already a good take-up. You know, we've got to scale it up. We all accept that because we've all got to understand that if we have got earache or a sore throat or sinusitis, then we can go to our pharmacist rather than speaking to our GP. That frees up GP appointments as well for more serious conditions. But we also, of course, this is funded. This expansion will be funded as well. And we're doing it in a really interesting and thoughtful way because we understand during the pandemic we had a huge increase in managers because the NHS had to cope with that.
You know, you're saying this, but you know that pharmacists are saying, yeah, we'd love to do more work, but actually we literally can't afford it. And you can't force them to do it, can you?
Well, I have to say, every pharmacist I've visited have seized the opportunity of Pharmacy First. We know that some 98% of pharmacists have, in fact, taken up Pharmacy First. And in the first month of it being rolled out, some 120,000 appointments were conducted by pharmacists. So that's great news.
That's tiny by comparison with what you're promising. You're promising to free up 20 million appointments, 120,000. And I know you say in the press release when it's scaled up.
Yeah.
You don't give us you don't give us a time scale. When do you expect to have these 20 million appointments?
By the end of the next Parliament. And so part of
next 5 years.
Part of my job is to help people understand that if they have the 7 conditions, if, for example, they are a woman and they have a simple urinary tract infection, then they can go to their pharmacist. They don't need to go to their GP. If they have shingles, if someone has shingles, they can go to their pharmacist. And we're extending these services now so that women can access contraceptive services from their pharmacist, but also menopause help. That's really significant, I think, for, you know, rather than having to queue up, freeing up GPs, but also helping patients. And we're adding chest and skin infections to this list as well. All of this, I underline, is based on clinical advice. You know, of course, a GP will always be there if needed for more serious iterations of these conditions. It's about using our community services more imaginatively.
You're painting a beautiful picture. But the point I really want to get to is, are you really doing it at the scale that the problem that you've identified demands? And let me just take you to another example. When you were last in this studio, we didn't get to talk about it, but you had recently launched the Dental Recovery Plan. Now, you describe this as the answer to dental deserts, places where people can't get NHS dental treatment. You're offering a signing-on bonus to about 240 dentists to join the NHS.
Golden hellos.
That's cost you about £5 million. And that is a sum that the NHS will have spent during the first 15 minutes of this programme. Now, you really aren't tackling the problem. I mean, these announcements sound good, but they are tiny by comparison with the need.
Well, you're right to identify the scale at which the NHS in England operates. So every single day, it's estimated that some 1.6 million people are looked after by the NHS. We have more than 1 million GP appointments and, excuse me, and I need to go to pharmacy first.
Every day?
Every day.
1 million
more
GP...
than 1 million GP appointments.
And my point is that what you're offering is it's a pinprick.
So, Trevor, bear with me. We provide 25.6 million more appointments now in the NHS, outpatient appointments now, than we did when we came into office in 2010 and we inherited the NHS from Labour. So the scale of the NHS has grown enormously over the last 14 years.
You've grown it by my arithmetic, and what you just said is about 8% over 15 years. Come on.
So with the primary care, what we're trying to do is to find alternative ways of delivering primary care in our community so that we can deal with the scale that GPs face. We know the frustrations of the 8 a.m. rush. It's why we've introduced telephony services to GP practices across England to help with that. We're also using the NHS app far more. We have 3/4 of adults in England now using that app. And Pharmacy First is one of the ways in which we can take a little bit of the burden off GPs, but also help people access primary care services as quickly as possible, faster, simpler, fairer. And with the second announcement I'm making today with GP surgeries, we're building or modernising 250 GP surgeries. That in itself, the 100 more GP surgeries that we will provide, that will provide tens of thousands, hundreds of thousands of appointments each year. And that in itself will be able to help local populations. We're particularly focusing our GP surgeries in areas where there's been housing expansion as well, because we've listened to
people. If I may say so, you're making a great fist of saying this is going to be terrific, but in truth, this is all of these things are rather marginal. Why don't you level with people? Because this is the kind of thing that makes people disillusioned with politics, isn't it? Why don't you level with people that when you're back in office, if you're back in office, there's no money left? Jeremy Hunt is pretty much saying that. His plan says that departments, not yours, will have to make cuts. But why can't you just level with people and say the truth is there are many things we can't do because we just don't have the money, rather than offering promises that you're going to get more GP appointments, you're going to be able to get a dentist and so on, when you know that's not true?
So if I can, on the dentistry, in the dental recovery plan, within the first a couple of months of that being rolled out, 500 more dental surgeries are offering NHS appointments across England. And we know that people are finding it easier to have a GP appointment as well. But
how many dental surgeries are there? I think there's something like approaching 7,000? 500 out of 7,000?
The community... And that's just in the first couple of months. This is why this plan, we are putting in immediate term, medium term and long term solutions. But on the community diagnostic centres, here's a really good example of the growth that we've seen and the improvements we've seen. We have built or secured 160 community diagnostic centres across England ahead of schedule. We've done a year ahead of schedule, and they have provided an extra 7 million tests, checks and scans. It's seen the largest central cash investment in MRI and CT scanners in the NHS's history. And what that means is more people are being diagnosed more quickly so they can get treated more quickly. We want to build on the success of that programme with a further 50 community diagnostic centres. And what worries me is that all the new hospitals that we're building, the community diagnostic centres that are in construction at the moment, Labour have said they will stop these projects to review them, which means delay and possibly cancellation, including, interestingly, in the hospital Whipps Cross that serves the shadow Labour Health Secretary. All right,
before you get onto the campaign trail, let me talk to you a bit more about the actual problems that you would have if you were back in office. Net migration is now running at knocking on for 700,000 a year. Over a third of nurses in this country are trained abroad, and that's 9 times higher than it was 5 years ago. And I, by the way, spoke to Yvette Cooper this morning, and we were discussing the fact that about a fifth of adult social care workers come from abroad. You want to reduce migrant numbers. Who is going to be running the wards? Who is going to be looking after the elderly?
Well, This is precisely why, a year ago, we brought forward the long-term workforce plan. Again, all of these plans have been in motion now for some considerable time, because we have tried to look to the future and to prepare the National Health Service for what it needs to celebrate the next 75 years of its history.
There are 180,000 vacancies in health and social care.
So with
180,000, your plan is not working.
So the long-term workforce plan, we already have set in train, and it will have to, we have to do this iteratively. You cannot produce doctors overnight. So we have already set in train the doubling of medical school places, so that by 2031 we will have double the medical school places. So my point
exactly, when you are asked this time next year, do you want to get down immigration numbers, or do you want to have doctors and nurses and adult social care workers? Which is going to be your choice? You cannot have both in the next year.
We have already set in train the training for doctors,
they're
for
not
nurses,
going to be trained up. What are you going to do?
Trevor, if I may, we have already set in train the long-term workforce plan, which is training doctors and nurses, midwives, dentists, GPs. We're going to increase the number of GP training places by 50%. We put this plan in motion a year ago precisely because we are looking to the future. With adult social care, because we are very, very mindful of the contribution that the international community makes to adult social care in particular, we have set a different salary threshold from the general salary threshold that the Home Secretary introduced in April.
So what I am hearing here is the word long-term. So essentially, you've made your choice that actually in the short and medium term, immigration numbers are going to stay where they are. You hope that at some point you're going to be able to train Brits, but actually for the time being, we're going to have this level of immigration because your service needs it.
No. So because health and social care visas are only one part of the immigration jigsaw. We know that the measures that we have taken in March, they are predicted to see really quite some significant falls in immigration, because there has to be a balance here. We want to welcome highly talented doctors and nurses from all over the world to work in the NHS, but we also want to train our own residents to staff our NHS and social care system, and also get that balance on immigration right. So that's why we have applied these thresholds. I mean, it's interesting. How surprising that Labour has suddenly woken up and decided that immigration, I'm pretty sure Sir Keir Starmer called immigration economic vandalism.
Leave Labour to me. Let's just deal with you. Last point about the campaign itself. There have only ever been 8 members of Parliament who defected from the Conservative Party to Labour. 4 of those have happened in this Parliament. Your own people think you're going to lose.
Well, I'm not going to comment on the individuals. They will have had their own reasons for going. It's a great surprise, I think, to everyone, including possibly to Natalie Elphicke herself, that such a hard-right Conservative politician should choose to join Labour. But then we see this week from Labour that Sir Keir Starmer can't work out whether Diane Abbott, one of his longest-standing and trailblazing members of Parliament, should in fact be a member of Parliament. He can't work it out. So it shows that there is a bit of
it will no doubt make you happy to know that Yvette Cooper tells me that they've solved that problem.
Oh, well, I'm sure that's right. I mean, we see today that Sir Keir is suggesting giving out peerages to solve the problem. And interestingly, inserting some of his boys' club into those very seats from which he's ejecting women. I have noticed that. But in terms of the election going forward, we are clear, we have a plan, we are taking bold action, as indeed today I've come on your programme to talk about with the NHS. We want to make, and we are making, our NHS faster, simpler and fairer. And that is because we want a secure future, not just for our country, but for our NHS. And with Rishi Sunak, we will deliver that.